Thank you for joining today to learn a little bit more about trismus and the OraStretch Press Jaw Motion Rehab System. My name is Sarah Schumann, and I am a speech pathologist and the Director of Education and Outreach at Cranio Rehab. If you have any questions, please do not hesitate to reach out to me directly. My email is on this slide, schumann@craniorehab.com. Trismus, sometimes referred to as lockjaw, is when a person has trouble opening their mouth fully. This can result from radiation treatment, TMJ disorders, trauma to the jaw, craniofacial disorders, oral surgery, and infections. To be able to discuss trismus, we first need to touch upon the average typical maximal interincisal opening, or MIO, for a healthy adult. This averages out to about 50 millimeters. A person is considered to have trismus when their MIO falls at or below 35 millimeters. An easy way to quickly measure this is with the 3-finger diagnostic tool. For a healthy typical opening, you're expecting a patient to be able to insert their 3 middle fingers vertically between the front teeth. If they're unable to insert 2 fingers vertically, they most likely fall within the trismic range. To get an exact measurement for maximal interincisal opening, we have 2 specific scales. Both scales come in paper and are disposable. The scale most people are familiar with is the rotation scale. It's straightforward to use. Simply hook the indented section on the bottom front teeth, or for edentulous patients, gently place it on the gums. Then rotate upward and use the millimeter scale that runs along the side to get a reading. Now for patients with a very limited opening, we have our prong scale. As you can see, it has a thin pronged piece, which you can insert between the front teeth. The scale runs along the pronged piece and also measures MIO in terms of millimeters. Both scales offer a lateral scale on the bottom, which is used to measure lateral excursion of the mandible. Furthermore, we also offer our deflection scale, which is clear in the middle to measure deviation and deflection of the jaw. It may also be used to measure tongue movement. Now let me introduce the OraStretch Press. It is a single patient handheld device for the prevention and treatment of trismus and jaw dysfunction. It is lightweight, easy to use, and has documented efficacy. It opens to 50 millimeters, which, if you remember, is the average adult MIO. There is a scale on the side for easy measuring and a limit screw on the top. The OraStretch Press comes in a variety of sizes. We have added and adjusted sizes to accommodate as many patients as possible. If you have a question on sizing, please do not hesitate to reach out to us directly. There are 3 main sizes: standard, pediatric, and interior. We also offer 2 bite pad options, standard and edentulous, and 2 add-on options, the extended bite plate and the power bands. I will go over these in more detail. As a general rule, we recommend starting with the standard size. This fits 90% of our patients. In the United States, we offer free size exchanges as well. We also send out the OraStretch Press with the standard pads unless edentulous pads are requested. The device comes with a bag to keep everything in, including a reusable plastic MIO scale, the safety screw, and an instruction manual. Here we have 2 of the most common exceptions to ordering the standard size. We offer a pediatric size for patients under the age of 10 or patients with an extremely small jaw. As you can see, it's the bite plate that is smaller in size to accommodate a smaller jaw. However, vertically, the width of the 2 bite plates together, both the standard and pediatric size require mouth opening of 6 millimeters to begin using. The second exception is regarding the bite pads. The standard pads are intended for patients with dentition, and the edentulous pads are softer and thicker for patients missing teeth. Please note that you can cut and adjust the pads as needed to make it work for your patients. It is also completely okay to use the device without pads if the patient does not have enough opening to add them on. Next up, we have the extended bite plate clip-on. This is for patients with a severe over or underbite. The bite plate clips right onto the standard OraStretch Press, extending one of the existing bite plates. You can place the clip on where it's most helpful, either the top or the bottom bite plate. Lastly, here is the interior version of the OraStretch press. As you can see, this is a much smaller bite plate intended for patients with microstomia or those who have an area that needs to be avoided towards the sides or back of the oral cavity. For example, areas to be avoided may include those with a wound or those that have tissue obstructing the standard mouth plate, such as from flap surgery. Now, if you have a patient who is finding that as they're doing their stretches, they are pulling the bite pads off, we have two options to try. First, have them try the device with a pad on only one bite plate. If this does not work for the patient, reach out to us and we will send out the extended add-on bite plate. Some patients' opening rotation works better with the extended bite plate, and this should fix that issue. For our head and neck cancer patients, we typically recommend using the OraStretch press without the limit screw. However, if you have a patient who is anxious about overdoing their stretches, or if you're worried about a patient overdoing it, you can use the limit screw. It is simple to use. Simply screw it in the hole on the top and use a scale on the side to decide where to set the limit. To prevent and treat radiation fibrosis in head and neck cancer patients, we want to stretch out the jaw area. Thus, these protocols focus on longer stretches. We recommend the 3-5-30 protocol, which is 3 sessions a day, 5 stretches each session, with each stretch held for 30 seconds. Now, if you have a patient who gets to an opening where they're satisfied and you're satisfied, what do you do going forward? Well, typically we do recommend that they continue the 3-5-30. However, if that seems to be too much, we recommend that they at least do their session once a day to see that their opening is maintaining and that they're not losing any opening. That way, if they do start to lose opening, they can bump up their stretches. For TMJ therapy, the goal is to use motion to reinforce the functional structure and to promote healthy synovial fluid movement. Thus, the protocol is a little bit different. So we have the 7-7-7 protocol, and that's 7 sessions of 7 stretches a day. Each stretch is held for 7 seconds. You could also do the 5-3 protocol. This would be 3 sessions that each last 5 minutes of gently opening and closing consistently. Another add-on option are the power bands. The power bands are designed to help patients overcome therapy plateaus or lack of progression. The OraStretch press comes with a card on ordering the power bands. They are not appropriate or needed for all patients, so we do not automatically include them. However, the patient can request the first pack complimentary. The power bands also offer an alternative therapy to squeezing the device by hand. The bands easily slide on the handles, and the more bands you add, the more resistant the patient feels. I recommend starting with 1 band, seeing how it's tolerated, and then adding more bands as needed. The bite plates squeeze together, insert, and spring open, applying pressure to the jaw. The patient is able to build up to 30 minutes using the power bands. This is most likely indicated for head and neck cancer patients. It is not indicated for TMJ disorder patients. Now, how do you clean the device? Well, it's pretty straightforward. You can clean those bite plates with a toothbrush, or you can dip the bite plate and pads in mouthwash. Don't submerge the entire device, as there is a metal spring inside that will rust. You can clean the body of the device with a damp cloth. Also, if you're changing out the bite pads, please make sure to remove all previous adhesive. Clean the plates with an oil-free soap, let it dry completely, and then apply the pads. You do also want to allow the pads time to adhere, so please allow at least an hour after putting on the pads before use. For those of you in the United States, we will check insurance eligibility and coverage. Patients also are able to order directly, and facilities can receive discounts when purchasing in bulk. For international ordering, please refer back to our website. We have distributors in the UK, in Australia, and in Canada, and we will ship internationally when needed. Here's our prescription order form for those of you in the United States. If you would like to have insurance checked, have your provider fill this out the best that they can. If the doctor is filling it out, they can sign at the prescriber's signature with the date. If it's a provider filling it out, they don't sign, and we'll reach out to the doctor to get that signature. We will then check insurance eligibility and benefits and reach out to the patient directly to let them know their coverage. Thank you very much for joining us today. Please feel free to connect with us on social media. You can also email us any questions at outreach@craniorehab.com. And you can also call us at 1-800-206-8381. Again, do not hesitate to reach out if you have any further questions. Thank you very much.